hole that the sperm has to get into. Yeah, in other words, at the end of the vaginal canal. Now, by the way, this is a really crappy model. Here's the labia minora. Here's the urethra here. Here's the clitoris. We don't see a preface on it. There's the clitoris. And here, of course, is the vaginal canal. The vaginal canal is a very muscular tube. It has to be muscular because at orgasm, it has to have contractions come pushing up this way. Why? The concept is once the sperm is in the vaginal canal, we want the musculature of the vaginal canal to push the sperm up toward the cervix. The cervix can be palpated from the vaginal canal. You can feel it sticking up as a little round portion just like this. And this is where we put a cervical cap on for birth control. This is also the entrance to the uterus right here. So that's the external os, which is leading into the isthmus, or the little canal there. And then we have the internal os opening inside the body of the uterus. Uterus is highly expandable, obviously, if it can accommodate a baby. One of the issues we have, obviously, with this arrangement is that the uterus here, once you get older or have a bunch of babies, this uterus presses down on the bladder. And when it presses down on the bladder, we call it a prolapsed uterus. Normally the uterus is pinned up against the body wall, but when you have lots of babies, it kind of stretches out, and as it pushes on the bladder, it decreases capacity in the bladder, so you have to urinate more frequently. If that's too bothersome, you have some surgery, and we pin it back up against the wall and take it off the bladder. So again, there's a labia majora, which is the outer lip or lips, labia minora, and again, this is a really crappy model. And there's the clitoris, which is erectile tissue, and this is the erogenous tissue, the primary erogenous tissue that will cause an orgasm and therefore muscular contractions of the vagina. Interestingly enough, the clitoris is here anteriorly, which if you look at dogs and cats, which mount from behind, you say, well, why would it be here if our mammal forebears have that kind of sex? Interestingly enough, humans and bonobos, a kind of chimpanzee, are the only animals that actually have face-to-face sex. And indeed, maybe that's because the clitoris is up here as opposed to back there somewhere, which is an interesting arrangement. So clitoris, this would be the labia minora. Majora is the large fold. This doesn't have the tissue out here. In the female, we have a thing called the mons pubis. It's an actually fat pad that actually sits in front of the genitals here, ostensibly for protection and face-to-face sex. But there is an actual fat pad there we call the mons pubis. So the mons pubis would sit out here, and the thicker outer labial folds, the labia majora, would be out here, labia minora, clitoris. This is, of course, the urethra, which sits anterior and superior to the vaginal canal. And interesting enough, since we have the labia majora and the labia minora here, interesting enough, bacteria can grow here a lot. And of course, we worry about bacteria coming up the ureter to the bladder. It's relatively short, maybe an inch long or so, ureter. We have to keep bacteria flushed out of that, and that's why frequent urination is advisable in a female to keep the bacteria flushed out. Obviously, if the male has a 5 or 6 inch urethra, he doesn't have to urinate as frequently to flush out the bacteria from the urethra. So a woman is much more prone toward UTI, or urinary tract infections. Vaginal canal, by the way, stays fairly acid. There are bacteria here that keep the vagina fairly acid, and that is protective of the vagina. In other words, it inhibits lots of pathogens, Trichomonas vaginalis, which is a protozoan, Candida albicans, which is, of course, yeast. They don't like the acid environment, so the acid-producing bacteria in here are considered part of the normal female flora, and it's ecologically protective. A female who takes too many alkaline douches, or may have taken some kind of antibiotics for something, may actually wipe out these particular bacteria, and once they're wiped out and the vagina becomes too alkaline, all of a sudden now Trichomonas vaginalis and Candida albicans can take root fairly easily. Again, those are the two most common causes for vaginoses, or infections of the vaginal canal. By the way, once you have one of those infections and you treat it, you want to reestablish the acid-producing bacteria up here as quickly as possible, and one of the home remedies is yogurt. The acidophilus kinds of critters will come in here and reestablish the normal acidity of the vagina. Last year, it was 2 years ago, I was telling class about that, and a woman raised her hand, and it was very, very sincere.